Thank you, I appreciate it. If I've not had the chance to meet you, my name is Michael Mestek, and I lead clinical research and medical science for Medtronic's acute care and monitoring business. My colleagues and I are incredibly excited to be here with you. We attend the Stoelting conference every year, and it's actually highly competitive to be able to get a ticket. And so we're honored to be here and to participate and to collaborate. And really what we want to talk about today is the role of equitable monitoring in helping you close maternal health care gaps. We think we have something to offer, and I'm going to speak from an industry perspective and tell you about what we're up to, and I think more importantly, how you can collaborate with us to reach our collective goals. All right. I don't know how to advance this. Does anyone know? Here we go. All right, so from an industry perspective, just like you with your case studies clinically, we take a look at problems from a big picture lens first and then try to drill down to what's going on at the individual patient level. So when we look at something like maternal mortality, always on a personal perspective, like so many have said already today, I'm stunned that we're in this position. It's shocking that we are here in the most advanced healthcare system in the entire world, and this problem is quite real. So we understand that, and as disheartening as those statistics can be, we also understand that the vast majority of this is preventable. And that's where we decide to direct our resources, where we see a big picture problem impacting you as providers, impacting patients, and we think that there's something we have to contribute to that problem. So then from there, we start to move from high-level abstract statistics and drill down to get an understanding as to how we can contribute for an individual patient. And as we've already heard many times today, the problem here that we have for women in this country is exacerbated when they are Black women. So there is this healthcare disparity that we see, and so we put a lot of time into considering what might be a representative patient. And in Medtronic, we've actually gone a step further and in many parts started talking directly to the patient to understand what their experience is and what their interaction with our technologies look like. And so as a side note, I grew up right here in this area, and so when I thought about it, I realized that I know one maternal health patient very well. And so if you happen to find yourself in conversation with a retired elementary school principal, that's my mom, and she's joined us here today for the conversation. So she took the train down and wanted to hear what we're doing, you know? And so I'm excited about that, and thank you for attending. So when we look at a patient like Clarissa, we know that our technology, as has already been mentioned, if we focus on pulse oximetry specifically, is going to be a ubiquitous tool throughout that patient's journey. And that can start in the emergency department. And we hear conversations talking about how we need to make sure that a patient doesn't have an oxygen saturation, let's say below 95, I heard, or we'll start screening for heart failure. So these numbers get really specific. 94 is different than 92, and the action that you're going to take. So obviously that means that our technology needs to work. It needs to be accurate on this patient right away as the patient enters the healthcare system. And we're hearing so much about C-sections, we know that intraoperatively there can be complications as well. And for a tool like pulse oximetry, we often think about the SpO2 value, but we also want to consider here the pulse rate for both the mother and the child, and also for the more sophisticated providers, the photoplethysmographic waveform and how that might be dampened in certain situations representing hemodynamic instability. And so we need to make sure that all of these components are working for all patients. And of course, that suite of vital signs is going to be a part of decisions to ultimately transfer the patient and then discharge them home to get to that successful outcome that everyone is looking for. So we're considering this now, and next year we'll certainly be at the conference as well and be talking a little bit more about how we're extending from that acute care setting and moving from hospital to home through a platform that we call HealthCast. So there'll be much more to come on that in subsequent meetings. So with that as a backdrop, I want to take you through some of the things that we've done. So 2 items that I want to cover. First, I want to talk about what we have accomplished over the last 5 years. So I want to talk about our commitment, but I also want to talk about a bit of a progress report on where we are, and then again, invite you to participate with us in the different things that we're doing. So my team spends a lot of time working on the literature, as you can imagine, just trying to summarize what's going on. And so post-COVID, as you're all well aware, there have been quite a few studies looking at how skin pigmentation impacts the performance of pulse oximeters. I think those can be summed up by this representative study in this ANA infographic. So this is based on work out of UCSF looking at dark skin pigmentation bias, particularly in low perfusion states. So they really wanted to identify this when it matters to you clinically. And the take home is really down in that third row, where if we look at this and say, well, what is the frequency of a misdiagnosis of hypoxemia across the spectrum of skin pigmentations, we see that it's virtually non-existent, about 1% when patients have light skin, and that ranges all the way to over 20% for patients who have dark skin. So obviously this has clinical consequences that have been well described. And our technology, Nellcor, has been on the market for over 40 years. We're extremely proud of how it performs and that we're a leading technology in the market. But at the same time, when we see something like this, an internal rallying cry for us became, we can do better. We can make a commitment here and we can improve the performance of our technology to make sure that we're working on all patients that you're treating. So we're looking at that from an SpO2 perspective, but then also, again, recognizing that we need to make sure that the performance of our pulse rate in this context of labor and delivery is accurate as well. So this is a study that was published not too long ago. It's independent from Medtronic. But we're looking and saying, you know, the requirements in this case are going to be a pulse rate where you get the signal right away on all of the newborns. We certainly need to make sure that that's something that you're getting, that it's comparable to an ECG in this environment, that we're not providing you with false positives for things like bradycardia that would interfere with proper care. So we're looking at this from a very holistic perspective and making sure that we get this technology right for you. And what we're finding, not just through published literature, but through our interactions, whether they be at conferences like this or when we're visiting in your hospitals, is that inequity with respect to pulse oximetry is not occurring from just one factor alone. What we're seeing is that there are a variety of SpO2 factors that are adding up, and subtle changes in them seems to be resulting in inequity. So those are things like the base performance of the technology that we're working on, but also things that require education. Still, even though this is a standard of care technology, we see that sensor selection, sensor patient placement is also extremely important here, in addition to things like the perfusion state or skin pigmentation. So these are all things that we're working on, and really it is our vision to empower you, the healthcare providers, with these best-in-class tools that are going to help you personalize care for every single patient, anytime, anywhere. This is not a slide that I made for this presentation. This is something that we present to internal and external audiences. It represents truly what we're about and what we're striving to do every single day. And you can see down in that third row that equitable care is a big part of our vision going forward. And we're doing pretty well, in fact, here. When you think about the tools that have been mentioned today, whether they be pulse oximetry or some of our airway management tools as well, collectively, that being us as the manufacturer, you as clinicians, our technologies are touching the lives of over 115 million patients around the world. And that's impressive to us, it's motivating to us, but obviously that also leaves room for improvement. There are more patients in more patients and more places that need our help, and that's what we're striving to do going forward. And so I want to give you some insight as to how we're thinking about this. I'm going to focus on pulse oximetry in particular, but this applies to so many topics that are relevant to APSF members, like brain health would be another good example. But with respect to pulse ox, I said that we can do better on this, and so I want to show you where we've started on this. Certainly that started with education. And many of you have participated in that. So education, not just to clinicians. What's been extremely important to us as Medtronic is getting out into the community. So we've gotten out into the community and started discussing challenges with respect to skin pigmentation. And the reason that we're doing that, and we're doing that fairly specifically in Denver, Colorado, is we started our own clinical physiology research laboratory that we're running there so that we can test the performance of our current devices as well as collect data that will be used to improve our future devices. And so this laboratory is off and running. I certainly don't envy folks like Dr. Main who have 5 minutes to establish trust with a patient. This has taken us years. It's taken us years to go into the community, to talk about the research that we want to do and why. But when patients understand what they're contributing to, we find that they themselves are extremely motivated because they want technologies that will work on people like them in the future. So to date, we've enrolled over 300 subjects in invasive hypoxia studies in our laboratory, and we have a wonderful breakdown across the Monk skin tone scale. We could break it down into tertiles. We can break it down evenly across sexes. And so we're doing very well in terms of representation, and where that's going to lead us is to innovation in technology that is going to help reduce inequities. And so we're just on the cusp of some really exciting things that are going to be coming your way relatively soon. All right. And what I want to do now is truly invite you to participate in this. And so that partnership is what is going to fuel the progress. And so, as I mentioned, it really does start with education. So my colleagues have put together this slide with a QR code on it. That's going to link you specifically to all of the materials that we have around equitable monitoring. So I invite you to take a look. There's a variety of things on there that are both accredited and non-accredited. So take a look. This is for you to consume. This is for you to critique. This is for you to help us take it to the next level. And so there's a lot of materials there. We would love your engagement, and we work with folks like yourselves in a variety of different ways educationally. So I'll invite you to reach out on that on the first front. And throughout the calls, there's been several calls throughout the day already for increased amounts of research on this. And certainly with what's going on from a federal funding standpoint, we consider ourselves to be a very viable research partner at this point. And we can do that in a few different ways. At Medtronic, we call this an external research program. Sometimes that's considered to be investigator-initiated, maybe investigator-sponsored, but this is where you can write a research protocol that aligns with that vision. That's all we ask, that it aligns with the vision and the direction you're hearing me speak about right now. If it does, we have a review panel, and we can provide different levels of support for research studies. That can be financial. Fully recognize that not everyone is comfortable with that from an industry perspective, so there's other ways that we can collaborate as well. Perhaps you just need devices, or you need sensing technologies, whatever that may be. And it's possible the most important thing that we can offer you is some of our expertise. You can imagine doing these types of research studies, the data acquisition for the volumes of data you could collect during a patient's stay can be overwhelming. How do you parse those data? How do you statistically analyze those data? That's somewhere where we can collaborate, and we can help you get these research studies done in quite a few ways. So please do reach out if you have interest there. And then finally, I know several people in this room have actually been to our Denver laboratory, but I would invite you to come visit at any point in time that you want to, whether you be on the clinical side or if you are from another company. We've developed and invested in expertise in the testing for pulse oximeters. We're going to be expanding that to other research devices, and we'd love to talk to you about how we can collaborate and how we can get this done going forward. And so that really is the spirit of what we want to do, invite you to collaborate on education, on research, on testing of these devices to make sure that we're achieving a common goal. And what's great about working for Medtronic is that for over 75 years at this point, everything I've said leading up to now is completely in line with the mission that drives this company. And really it comes down to these 6 words for us. We want to work with you to alleviate pain, restore health, and extend life. That's our mission. We want to partner with you to achieve it. So thank you for your time, and please do reach out. We'd love to hear from you going forward.